An 80 years old lady is brought to the emergency department by her carers. She has been unwell for the past few days. On examination, she has a cold, pulseless leg with fixed mottling below knee. A duplex scan shows there is a stenosis of the profunda femoral and popliteal artery with no flow distal to this. What is the most appropriate course of action? So the patient present with the pulseless leg, that means there is no pulse, fixed mottling, that means the dead of the limb below the knee, and on the investigation, which is the duplex study, it shows the profunda femoral artery stenosis and popliteal artery stenosis, and there is no distal flow. So what may be our course of action for saving the life of the patient? Here the options are femoral crossover graft, axillofemoral bypass graft, transfemoral amputation, geeky stroke amputation, administration of intravenous unfractionated heparin. So what is our course of action? Here we have to keep in mind that there is a fixed mottling there, that means there is the death of the tissue of the leg, so there is no option for the salvage. So here we can see this is the deep femoral artery. So here the deep femoral artery blockage, and also there is a blockage of the popliteal artery here, and there is no distal flow. That means in this area there is no blood flow. So this part of the leg is completely destroyed. That means it's completely dead. So what may be our next option? So here the flow present up to the superficial femoral artery, and also the deep femoral artery also blocked. So it is the management. Here we can see this is the management of acutely limb ischemia or acute limb ischemia. When there is a white leg, sensory motor deficit, in this condition surgery and embolectomy is the option. Dusky leg with mild anesthesia, in this case angiography, and when there is fixed mottling, in this case primary amputation. So we have to go in this patient primary amputation. There is no way of salvage of the leg. When there is a white leg, so in this condition surgery embolectomy. When there is dusky leg, angiography, but in case of the fixed mottling, go for primary amputation. Now see, when it is present less than 6 hours and white leg present, when 6 to 12 hours there is motor limb with blazing on pressure, and when it is more than 12 to 24 hours, in this condition fixed mottling, and fixed mottling it present more than 12 hours or more than 24 hours, and it is the dead limb. So in case of the dead limb, direct go for amputation. And when there is the white leg, in this condition surgery or angioplasty or angiography is the option. So the fixed mottling is a sign of an unsalvageable limb. There is the salvage is not possible. Mandate either amputation or palliation. And on the other options, such as through the knee amputation, geeky stroke is unlikely to heal in this setting because the patient is old age, about 80 years old. So it is the through knee amputation. In this case, healing is very poor and sometimes may require re-amputation. For this condition, we should go for transfemoral amputation. Other options here, such as the femoral crossover graft. Here graft has no role because the limb is already dead. So if we give blood, it is not possible to make it live, and also there is a risk of development of reperfusion injury. And other options here, geeky stroke amputation, which is the transcondylar, which is the, here we can see the through the knee amputation. In case of the knee amputation, healing rate is very less, and in this condition re-amputation required. So we should not go for the geeky stroke amputation. At administration of intravenous unfractionated heparin, it also have no role because the heparin, what heparin do? Heparin prevent coagulation. Heparin prevent coagulation, but there is no role of coagulation here, anticoagulation here, because already there is thrombus formation, or already there is the dead limb. In case of the dead limb, heparin plays no role.